Mr Mike Penning.
Mr Deputy Speaker, and it's a pleasure to follow many colleagues who have from the heart talked about the great concerns that their constituents and we have as our family members within the health and social care framework. I will be supporting the bill tonight because, as I said last week, kicking the can down the road, which has been done by several governments for years and years and years, is not the answer. But I do have a couple of questions that I would like the Treasury Branch to address as we go forward. I completely agree with the Chairman of the Health Select Committee that if we just throw this money into the NHS and Social Care Department, it won't even touch the sides. It will just disappear into the Met. And it's been done before. It was done on previous governments and it's done on governments now. So we have to be really careful how this is hypothecated and where this money goes. And I'm particularly worried about the fact that it's the top management, those that earn so much, that won't actually address the issues that we're talking about today. The people in the front line, I naturally pay tribute to all the frontline workers in social care and all of our emergency workers and those within the NHS. But the decisions that are made and the salaries that some chief executive or trusts are on, frankly, it's not only miles above what the Prime Minister gets, it's miles above what the city would even get. It is absolutely bonkers. So we have to be really careful about that. And that the trusts do, and I know this is going to be addressed in the health bill, but they do what Parliament tells them to do. We cannot have a situation like we had again, I mentioned last week, where the Prime Minister goes into my part of the world and says, you're going to get a new hospital. That's fantastic news. I put press releases out galore. We've been campaigning for this for years. And what we're going to get is a refurbished Victorian hospital in the middle of Watford. That's not the answer. They need to do what they're told. And then if I can just touch on one other area, which is really the elephant in the room, and the Honourable Lady for Rushcliffe touched on this, which is dementia. And the lottery that goes on with our constituents and our loved ones when you're trying to sort out the difference between personal care and health care when it comes to dementia and Alzheimer's. It is immoral what goes on, where one silo, which is the health department, is fighting against the local government department as to who might pay for that care. In my own family, we've seen it, and in my constituents and in my surgeries, I've seen it, where we've been fighting to appeal. They seem to want you to appeal, so you then appeal, and by the time you actually get to the situation, many of our loved ones and many of these people in care have passed away. And then you win. But something is seriously, seriously wrong. So as we look at this extra money that's going in, we must break down these silos between the really immoral way that we judge postcode lotteries going on around the country today, how we judge who is entitled to health care, who is entitled to personal care. If you have dementia or Alzheimer's, I always mix these two up, it's an illness. It's not something someone wanted. It's not someone they personally brought on themselves. For many of them, they can't do anything to. But you have to fight to say you have another condition to make it worth that the health department might pay for that. I hope as we look at what's going forward now, we can try and address that as these difficult conundrums are taking place. But we can't put our constituents, and in my case, and other members' loved ones, in a position that they have to beg for something different than actually the condition they're in care for, which is Alzheimer's and dementia.
Jim Shannon.